Doctors of Reddit, what patient made you scream? How is this even possible? Not a doctor, I'm a paramedic. But we had a guy stabbed in the chest, so close to the heart, or major vessel, you could watch the knife handle move with each heartbeat. We had a female admitted to the ER with severe stomach pains. At first, we suspect pregnancy. She insists she isn't pregnant, has had zero sexual contact, etc. Hormone levels are normal, so we do an ultrasound to confirm a possible uterine or ovarian tumor. Rather surprisingly, she had a first trimester unbirthed miscarriage that was over 7 years old. Apparently it did not occur to her that not having a period for 7 years wasn't a problem. We ended up removing over 6 pounds of necrotic tissue, including a partially formed fetus, which completely changed her life. She was in her 40s. MD student. Saw a guy come in post motorcycle crash, foot hanging off his leg at the ankle by just a piece of skin. Imagine a mozzarella stick once you pull it apart. Went up to the or immediately for a replantation. Ended up saving his foot. Nurse student. Drug user who had a hole, don't know how to say it in English, under his right arm, creating a cavity around 10x10 centimeters, maybe, from which you could see and hear whistling the right lung upper lobe. It had been worsening for maybe 10 years, so the initial injury had mostly cicatrized, without infection, as crazy as it may sound, so the cavity instead of flesh was mostly covered by epithelial tissue. The pneumologist told me that this was a once-in-a-lifetime case. He spent just a morning in my unit, so I didn't get to know the outcome, diagnosis tests and everything he had, but we were pretty sure he also had a neoplasm going on in that cavity. I was a patient. We thought I had the flu, and I mentioned my right side hurt, and had a bump. They decided to check for gallstones. Nope, huge freaking tumor on my liver. When it was removed a week later, it was 7 pounds and the size of a dinner plate. I was a tiny 90 lb 16-year-old girl, no obvious signs of it. It pushed my lungs up and intestines down. It had outgrown its blood supply and begun to rot, so when it was removed it burst like a piece of rotten fruit. Apparently it was the only case my surgeon had seen in his career. I'm in a medical journal and everything. My mother is a nurse in the ER, and she talked to me about crazy shit that's happened. Apparently one guy walked into the emergency room entrance holding his intestines in his hands, calm as can be, and shouted, "Can I get a little help please? I think I'm gonna die." Now this dude wasn't gutted wide open holding all of his entrails, but he had a pretty major cut to the midsection causing some of his intestines to be protruding externally. This dude is alive, and my mom told me she has no idea how someone could walk into an emergency room like that and be so calm. Not a doctor, but a family member of mine is currently going through an inpatient mental facility. She was escalating in a freak out, and they gave her a shot to sedate her and calm her down. Nurse said it was good enough to knock out a 230 pound male for 8 hours. They slept for 2 total. Hypomania is a bitch, man. Nurse said she was very shocked that the shot didn't knock them out, but they were having such a bad episode that sedation hardly did anything to them. Radiology resident 2nd year night float. Our hospital is a major tertiary care center, so we handled complex and rare diseases and accepted transfers other places couldn't handle. But we didn't do a lot of trauma. Night float in radiology had a typical pattern, being crazy busy from 7 p.m. until about 2 a.m. Then it died down, and you could usually get a nap in. I'm sitting at my PAX in and out of sleep around 3 a.m., periodically opening my eyes to check the list. While they were open, the dreaded red stat icon pops across the list and I see a CTH chest abdomen pelvis. Reason for exam was high velocity MVC, unrestrained, plus LOC. So I'm like, yeah right sure. I open the study and get to dictating. It's a young guy, 20 something. So his insides aren't bad. Then I get to the thoracic aorta, the biggest arterial vessel in your body. It was transected. This means cut in half basically, and there was fresh blood all throughout the chest cavity that contains the heart, the mediastinum. This has a 90% mortality rate at the scene of injury. For those 10% that don't die there and make it to the hospital, it's a 50% mortality. This usually kills you. I check the chart and see this guy was drunk, high, had no complaints, and was being an asshole to her staff. I wanted to go down there so bad and tell him, dude, you know how lucky you are? I called the ear doctor and she didn't believe me. Then she opened up the study for herself and was like, oh my, we are not a trauma center. Vascular surgery came in and put in a stent graft and the guy did fine. I really hope that guy took home some sort of lesson and changed things. Not a doctor myself, but I'm sure the ear doc was saying this when we took my grandmother to hospital. She called my mom saying her blood sugar meter was reading H1, 8-segment display. My grandmother was 77, visually impaired from diabetes, really was saying hi. We take her to the local ear. The meter in the ear returns the same. Blood work sent to the lab. Came back 39.9 mol/L, 718 mg/dl. Doc said she should have been in a coma at that level. But there she was, alert, orientated, and just concerned about the high reading. Story time first, some backstory. In Brazil, you can do internship way earlier than in most of America and Europe med schools, so keep that in mind. I was in my 4th year of med school, and in the first day as an intern in a trauma hospital, after training, there was a bus crash right before, so all the staff was occupied, when a woman came in screaming, I am going to die. I got shot in the head. When I look up I see a really thin woman, deep eyes, white as snow skin, with a bullet hole in the center of her forehead. She told us she owed money to a drug dealer, and he put a gun against his head, shot and ran. Now, I believe because she has burn marks and gunpowder right there in her skin, and a hole. Now remind that I'm a student, and there was no available doctors in the moment. So I run to my professor, that was with another patient, and tell her story, and also that she is lucid, with normal life signs, and get her order to do a CORT scan. The CORT shows that the bullet entered the forehead trough, the first layer of the frontal bone, but not the second, and headed down trough palatus, traught and stopped at a vertebra, C5 if I recall correctly. No brain damage at all. So we intern her, and a tracheostomy is put in place, along with emergency reconstructive surgery, only a first, not definitive approach, along with a cervical collar. After she is stable, 3 hours later in her room, 3rd floor, we go down to see other patients. The emergency then gets a call. Hello. We are from the ex-hospital, 20 kilometers away from ours, and we found a patient of yours in our emergency. Then the nurses on the floor realized she was missing. She jumped a 3rd storage floor, broke her ankle, and got in buses, and went the other hospital. Why? I saw him in here. He came to finish the job. And before you ask, yes, some people lost their jobs. I'm a younger person with severe rheumatoid arthritis. I've had multiple doctors/surgeons who couldn't believe I walked into their office. I can't believe you're not in a wheelchair comes up a lot. The surgeon who did both my hip replacements was about 65 years old and had 20 plus years just doing that. Said I was one of the worst cases he'd seen and was amazed I could walk. I think my favorite was the time I got an x-ray of my lower back. My exchange with the technician reading it was something like, Tech, do you have scoliosis? Me, no. Tech, oh. It's difficult when medical staff examine you and their only response is oh. It happens kind of a lot for me. I was the patient on this one. One night, I woke up with really bad pains in my stomach and went to the hospital. I'd had stomach pains on and off for a few weeks but nothing too painful. This was just the breaking point and I finally went into the ER and was immediately given morphine and a CORT scan of my abdomen, at which point the tech asked again if I'd only started having the pain that night. I kinda mumbled a yeah. I was wheeled back and not 20 minutes later I was being rushed in for an emergency appendectomy. No big, 2 hours tops. At 9 o'clock am, I climbed onto a table. I was woken up at 5 p.m. I had tubes down my throat and just felt exhausted. Apparently, I walked around between a week and a month while my appendix ruptured and didn't go septic. I had serosital SP appendicitis, which is really rare, and apparently my colon tried to absorb the ruptured appendix. A mass was removed from my stomach containing what the pathologist listed as possible appendix, but there was so much tissue they couldn't be sure what was what. I lost between 6 to 12 inches of my colon and had a temporary colostomy for about 9 months after. Surgeon told me he lost sleep trying to figure out how I made it to the operating table.